I'm Anthony Nguyen. Join us as we change the narrative around aged care, one story at a time.
Hi, that's it.
Welcome back to the Pioneers in Aged Care podcast. Here we have Fonda Voukelatos, the Deputy CEO at Uniting AgeWell. Thank you so much, Fonda, for being on the podcast.
Great. Thank you, Anthony, and thanks for having me here today on this beautiful, bright day. Thanks.
I'm very excited to have you on. I've heard some amazing things about you. People are singing your praises with your participation at this event, which I'll want to give a quick shout out now to Accolade and the Healthcare Channel. This podcast is in collaboration with the Healthcare Channel podcast. So thank you so much for hosting this amazing event and bringing all these people together to move the industry forward. So can we start off with getting a broad overview as to who Uniting AgeWell is?
Yeah, so Uniting AgeWell is a not-for-profit organisation. We're limited by guarantee. We are owned by the Uniting Church and Australia Property Trust, Victoria and Tasmania. Uniting AgeWell has been in existence formally for 20 years. Prior to that, it was a number of Uniting Care entities in Victoria and Tasmania that had different boards, different executives, but then they formed one group about 20 years ago, and that became Uniting AgeWell. So currently we operate across Victoria and Tasmania. We're a very large not-for-profit provider. What does that mean? It means that currently we have 21 residential aged care facilities across Vic and Tas. We have 500 retirement village units, and we've also got, we support about 15,000 participants in the home care space, a combination of home care packages and the Commonwealth Home Support Program. We cover all parts of Victoria and all parts of Tasmania.
Okay.
Yeah.
So part of the Uniting Church.
Yep.
Because that always confused me. I see Uniting, there's Uniting NSW.
Yep.
And SA.
Yep.
I think Juniper in WA is part of the Uniting group. So these are all separate organisations. Is there collaboration?
There is collaboration on an advocacy front. So we come together. So there is a national body through Uniting Care Australia that undertakes advocacy and policy influence with government on a number of fronts. So there's an expert group of Uniting Care Australia aged care CEOs that come together regularly, and they digest policy, they influence policy, they look at how we can collaborate across cool things, for example, responding to the Royal Commission into Aged Care, how we do things like that. So there is a degree of collaboration on that front. Yeah.
And talk me through, from the employee experience, what are the benefits and positives of being an employee of Uniting AgeWell?
Yeah, so, and maybe I'll start with, one of the reasons that I'm at Uniting AgeWell. So I joined Uniting AgeWell now 10 years ago. And what I loved about the organisation at that point, and in no particular order, there's a few things that really attracted me to it as part of my due diligence at the time. One, it was a modest organisation. It probably isn't an organisation that beats its chest and says, look at the amazing work we do. So as a firm, as a company, it's pretty modest. And yet its reach is significant from person-centred care through to community development, through all these other little 1%ers that no one really sees. So I think that was really important for me, in terms of having joined up values. Outside of that, the other big driver for me, and I know this is a driver for a lot of our people that come in, is the organisation's values resonate with people. So they're intertwined with people's own values and their own goals and aspirations. And when you look at the Uniting Church in general, and even though I'm not part of the Uniting Church, from a religious front, the values around social justice ring true. So, we see those enacted each and every day, when we work at a business. And I think that's been a big driver for our personnel. The other things are that, when you look at our strategic plan, everything we do is centered around the customer experience, but the only lever we have to do that is about having energized personnel and staff and volunteers and all that. So we invest very heavily in staff development, cultural development activities, leading by example, role modeling, the leading servant sort of type model and all that. So yeah.
Tell me about your journey into aged care.
Well, it was a bit of a coincidental journey, can I say? So my early education or tertiary education, I spent a lot of time in universities. So I attained a Bachelor of Science qualification here, well, in Melbourne, not here, we're in Sydney today, and then graduated and undertook honours research through the medical faculty, particularly in those days, looking at the interface between pain perception and people, looking at people with dementia. So there's a lot of anecdotal information, but people with dementia didn't necessarily feel pain. It was all subjective, nothing really objective. So we did some seminal research that involved actually speaking to a number of people with dementia and their family members, but then measuring things objectively through brain waves and using cool things like carbon dioxide lasers and all that, and getting just to making sure that you could understand people's pain. And what we found was that, in fact, people with dementia did feel pain in the same way that we all do. It's just that the nerves take a little bit longer to process them. So whilst it would be a matter of microseconds in someone not affected by dementia, for someone with dementia, it will take a little bit longer for them to register that pain. And that was pretty cool research and all that. But then what I realised through that, so I was offered the opportunity to undertake further research under a PhD. I thought, it's not probably what I want to do. So what I actually got a lot out of was the storytelling from those elders. Everyone had a story to tell, and I found myself when I was talking to people that they'd tell me about their history, their family, what a meaningful role looked like, their contribution to their local community, to their family, what was really important for them. And I thought, actually, it's really not the research that I'm pursuing. Probably got a different type of aspect on it. And then through that, I went and worked in a dementia activity program. I volunteered a little bit in other dementia programs as well. And then through that, moved into local government, not-for-profits, worked on national policy with the federal government at one point, and have been at Uniting AgeWell the last 10 years.
Amazing.
Yeah.
What so I was actually, you did answer the question, because I was going to ask, through your research in dementia, I was going to ask what your takeaway from that research into Uniting AgeWell is. You mentioned storytelling.
Yep.
I was wondering though, was there anything from anything else from your time in research and academia that you have brought into Uniting AgeWell?
Yeah. So, when I talk to my colleagues and people in our organisation, I'm a believer, personally, that everyone's got a superpower, right? Things that people are really cool at, they just may not be able to articulate it. And one of the things, which is one of my bents and probably one of my capabilities, is around analysing a lot of information very quickly and making it really quite simple. So if you listen to my language, there's no consultant speak or anything like that. Really simple language, but you can take a number of different data points, or and they could be other aspects and all that, and just try to synthesize them and make them very simple. So that was probably one of my, because of my background, and I love data and I love analytics and all that, the challenge for me early on was, how do you flip that and make that simple and accessible? And I feel that's put me in really good stead in the health and aged care space. I think also naturally, and why I loved research is because I'm naturally an introverted individual and introspective. I've had to really come out of my comfort zone. So now I'm a noisy introvert. So chat. But I love hearing from people, So this is a little bit uncomfortable for me, having to talk about myself, because it's not something I want to be doing necessarily. So
No, well, you're doing fine.
yeah.
Now, when I did mention, I mentioned to a few people in my network that I was having you on, and a few of them were excited to ask a few questions.
Yep.
So I'm going to ask a few questions from these people. So the first question is from Julie Hogarth Williams, the CEO of the Seniors Channel. So I recently interviewed her, and she had a career as a professional entertainer for seniors. So she understands the power of shared cultural experiences.
Hello, Julie from the Seniors Channel here. Here's an interesting question for you. How do you think technology can be used to recreate that sense of community and shared joy that comes from a live performance or a group activity? Would love to know your thoughts.
It's a really good question. So it's a really good question, could I say? So maybe if I could give you just a few pragmatic things that we're looking at doing, or that we've been in the process of doing over the last few years at Uniting AgeWell. So we run within our organisation. We're fortunate enough that our board has invested in a research and innovation stream. And what that means fundamentally, and that's probably one of the other things that I brought into our sector, is that research bent, the value of research and evidence-based stuff. So one of the things that we have fundamentally hooked into is around co-designing services and programs based on the needs and the aspirations of our participants, existing and future and prospective participants. So when I look at some of the programs that we're running from a cultural perspective, so we don't profess to have all the expertise ourselves, and what we have done is linked up with maybe specific called communities or called providers who really understand their communities quite well and co-design initiatives with them. The accessibility around that is, well, how do you make it accessible and how do you link back through technology? So there's a number of things that we have undertaken. During COVID times, as an example, we're fortunate enough to get some grant funding to have co-designed tablets in people's homes, which were basically, it's almost like a chatbot type thing, but also linking up with the individual to create content that was specific to them and their cultural needs. Really useful for people with dementia, we found, in terms of having that soothing environment for them, but also that connection back to their country of origin, and some of their cultural things. We also started to set up groups of people with like interests and all that, and make sure that we tailored programs like exercise programs to specific cultural groups. So, e.g., we're running online Tai Chi groups. And that's been quite successful. And the good thing about that, so we run these types of exercise programs now, is that when you're talking about people in regional, rural, remote areas, where you can't necessarily go and get a physical exercise physiologist to go out, how do you tap into that as a resource? And how do you engage with your home care workforce to be there to support that individual?
This is a in-house development?
Yeah, it is. It is. And it's nothing, I wouldn't say it's extremely innovative, but what it is, it's customer-centric.
Yeah.
Yeah. So it's like, if we're saying that our customers are wanting this, they want to be safe at home, they want to maintain their health, they want to tap into exercise and all that, they want to engage with other like-minded people, then the role of our organisation is how can we help them facilitate that? And can we do that ourselves, or can we do that in partnership with other third-party providers? Yeah.
I love that. Yeah. I think what I love is because and most people who don't know anything about aged care still have this view of aged care from 20 years ago.
Yeah.
The nursing home, people in their rooms, lying in bed. And to think now that aged care organisation is developing these tools specific to cater for their residents, doing something more than the essential job description.
Yeah.
Yeah, that's why I'm excited for it. And you say it's not innovative, but it's still an indication of where we're going as an industry. And I do think it's innovative. It's a solution that yeah, not too many people are looking at right now.
Yeah, and I think to be frank, I think we can learn a lot from some of the adjoining segments. So I know there's a big on the pointy end around chronic disease management and health outcomes and all that. That's only one part of the equation for an individual. On the other side of it, and where I think we could take a lead, is from the disability space. You know, that sector in Australia and overseas has gone through a major transformation from the 60s onwards around social role valorization, which was honouring the individual, that whole sense of personhood, authentic relationships, right relationships. You know, so our current Aged Care Act, and the new one promises to be really amazing, right? If we, the next 5 years, it will be, I reckon, where it fixes the human rights of individuals in the centre of it is the zone we need to be in. So I look at, some of the things that we've co-created with, Flinders University, for example. We participated as one of their foundation members to develop Australia's first evidence-based outcome measurements framework in aged care. You would think that by 2023, 2024, we would be all across that as a sector. Well, in disability, they've been doing it for 30, 40 years. But what about aged care? So we were trying to adapt all these tools from different sectors, but in fact, aged care, because of the population and because of where seniors are at and elders are at, now we've got a tool that was actually featured, in the Royal Commission into Aged Care as something that providers should take on. Yeah.
The next question is from Dane Mitchell, the Managing Director of Optimum Allied Health.
When you look at the goals of the new Aged Care Act, specifically the focus on realablement and restorative care, what are the biggest operational hurdles to embedding a truly proactive and consistent allied health model across all of your sites? And what role does data play in demonstrating its success?
Yeah, it's a really good question. So there's a few cultural challenges, I think, for organisations, and I look at our organisation as well. The predominant one is to understand the value of allied health and what it provides to the individual. So, I think we talk about restorative care and realablement, but what does it pragmatically look like? So, for our care advisors, some of them who are not clinicians, for example, they may be really good at, exercising or taking people's information on board, and they'll say, yeah, I need personal care, or I need cleaning support, or I need X, Y, and Z. Fundamentally, that's good. Foundation, right? Maslow's hierarchy. But beyond that, if you want to optimize and you want to stay at home, right, if that's predominantly your goal, well, how can a multidisciplinary team come across that at the right time with the right service levels to make sure that you can remain at home, that you're not at risk of falls? And we see a lot of falls, right, in our community. Some of them go unregistered and all that. What about things like continence support, all these other aspects and all that? So I feel that our challenge culturally is to get our staff to understand that. So there's an education piece there for them, but there's also an education piece for participants in aged care as well to fully understand the benefits of, say, having physiotherapy intervention or exercise physiology intervention. One of the things that we've been doing as an organisation, which I feel is probably, again, not overly innovative, but probably brings that restorative care aspect into people's spaces, we've created health and wellness hubs across Victoria and Tasmania. So we're rolling those out now. And they go beyond just doing day therapy activities. They look at holistic needs, wound management, continence, auditory, optics. They look at falls and balances, bone density, workups and all that, oral health, because they're all the key factors that people need to have a good life. So how do you bring all those things together? So I think there's a challenge. I think there's also a challenge personally from the government perspective. You look at the new levels of package, highest level is 78 grand, right? Top up. And then, you can get some additional funding, if you're palliating the last 3 months of your life or you need some equipment. I compare that to the NDIS. There are people on $1 million packages, right? So we have to break through that ceiling. if we are genuine that older people should remain at home, it's not going to cut it if you're getting a physio appointment or a physiotherapist seeing him once a month. There's going to be a front loading of intervention there. So I think there'll be innovative models coming through, but we've got to look at it very differently. The benefits are this. So the way I look at it is that if you develop an evidence base, then people should be able to stay at home longer and have a better quality of life. So that's the key measurements that we need to put in place, right? That's what I postulate or hypothesize should happen with the interventions. So, and quality of life hits on their enjoyment, the decline in social isolation, better, less hospital admissions, et cetera, et cetera. So there's a number of metrics you can put in place to measure that and make sure you're on track. Yeah.
You mentioned those clinics where you look at hearing, the vision, oral health.
Yeah.
Are these part of the facilities or are these separate clinics?
Well, so what we've done, so they're part of our home care line, but they serve also our residential aged care residents. And the idea is that, so what we want to set up and what we're in the process of doing is setting up a Uniting AgeWell neighbourhood where you've basically got a catchment or a geography. You've got your residential aged care services, your retirement village services, and your home care services. And then you've got the wraparound services. But the Wellness Hub for me is integrated as part of home care, and it's got an outreach function where you visit people in the home and people who may not be able to physically make it, or we offer things like shuttle services or transport services, because transport's important to tap into those clinicians and those specializations. Yeah.
The third question I have here is from Nilesh Bansal, principal and founder of Aurelia Legal. He's an immigration lawyer, helps with the 482 186s. What are the biggest hurdles you face in building a supportive workplace and community for your international staff to make them want to build a life here? In short, how do you protect your investment and stop the leaky bucket of losing valuable talent you've worked so hard to bring in?
Goodness. So Uniting AgeWell, operates in pretty diverse locations. I know at some of our sites, we've got a significant mix of different cultures. So at one site in the inner west of Melbourne, we have staff from 45 different nationalities. And that mirrors the residents who come from very different nationalities as well. So our position on our process for staff, so we are open. We're a very diverse organisation, so we appreciate diversity. We take people for a really thorough induction and orientation process and equip them to be the best they can be in their roles. Pragmatically, that may look like they have buddy shifts in place. We're looking at running a number of programs where, for example, we've subscribed to a program and running a trial now to leverage artificial intelligence to look at people's native language and translate that into case notes. So we're validating that right now, and that's a pretty cool project.
Yeah.
So that means that people who, where English is not their, first language and all that, feel like they've got a voice and all that. And I think over time, we'll be able to transpose that so that, that there could be that communication two-way with, our residents. And
is that another in-house development?
That's in partnership with Microsoft. They've got I'm not sure if you're aware, but about 2 years ago, they launched an aged care incubation lab here in Australia.
I didn't know that.
Yeah, so there's about 6 or 7 foundation partners. Uniting AgeWell is one of them. And, imagine, being able to leverage Microsoft skills and expertise, because they obviously see Australia as being, an innovative place, but probably on the bleeding edge where they want to be supporting the sector, to trial really cool things in the AI space.
Yeah. What has been your key takeaway from this events. So as mentioned, again, I want to say thank you to Accolade and the Healthcare channel. This podcast, Pioneers Podcast and the Healthcare Channel podcast, doing a co-branded podcast.
Yeah.
And yeah, for me, the event has been amazing. Is everyone is really passionate about and enthusiastic about where aged care is going. What's been your key takeaways?
Yeah, so I think I also want to acknowledge, Accolade and the Health Channel as well. I mean, for putting such a good professional event with diverse speakers. So my takeaways have been, again, in no particular order, is the ability to network with people. Like you said, people are really forthcoming with their information. You can have a water cooler conversation with someone, strike up a conversation. What I do like about it, and everyone that I've met so far, isn't talking about systems and administration, even though that's important. They're talking about the human. And I think that to me is a takeaway that really is quite refreshing for me, because it's really, you can get really caught up in the reforms and compliance and regulation and the administering of a business. But taking it back to what we're here to do, which is really serving people and elders of that, is really important. So I think that's been really cool for me, and to engage with people on that front.
Yeah. And what's on for the next 12 months with Uniting AgeWell? What are you hoping to achieve?
Well, probably a number of things. So, we're currently on a growth trajectory, and we've grown significantly over the past 10 years, and we want to probably double our size, not in the next 12 months, but maybe the next 2 or 3 years.
Yeah.
I still feel that we have a lot to say in terms of influencing policy. I think we still have a lot to do in terms of engaging our customers. When you've got such a connected base of people, and we've got 15,000 people just in home care, the challenge for us is how do you connect with each and every individual and make sure everything's personalised and that they've got a voice, and that they feature in our future plans. So that's a challenge and an opportunity for our organisation. And I feel our board, and this is a sense I've got clearly, is driving innovation through, digital investments. So I think it'll be very different going forward.
Yeah. And finally, could you share something about yourself outside of work, outside of aged care? What are your interests?
Yeah, well, it's a good question. So, look, I'm a tragic around sports. So I could watch any sport, any time of the day. And I've extended that recently to even watching EA professional sports, which is, people on the gaming.
Hey.
Yeah. I see.
What type of game?
I don't. Well, it's just like people are, they could be playing things like, I don't do it myself.
Yeah.
But I watch them on TV. These professionals, you get paid big bucks to do it.
First-person shooters, Call of Duty.
Yeah, that sort of stuff. What's going on here? So I can sit down in front of a TV or anywhere. Live sport is cool, but also watching it on TV, I really am fascinated with the effort and the energy and the discipline it takes for people to become so good at their craft. So
we hear about the 20-80 rule, where put in 20% of the effort to get 80% of the results. But at the professional level, they're putting in 90% effort to get that 1% out. And that's where the magic happens. I love watching the struggle to get there. I used to dabble in powerlifting. I was nowhere near the elite level.
Yeah.
But the fun was trying to lift that extra kilo and just grind out the amount of effort and preparation and the weeks of training to get an extra kilogram out. So when I translate that to what a professional athlete must do day in and day out, it is really inspiring, the dedication and discipline.
Absolutely. And on a very personal front, I've got 3 boys, 13, 15 and 18, but probably 23, 25 and 28, in terms of how they feel some days. A lot of them, the boys are really active and all that. They play, in amateur sort of soccer competitions in Melbourne. I enjoy going to their training. I enjoy watching them on match day. And I think I'm really going to miss that. once they become more independent, give her cars and all that, you know, so they've got their own. So I'm going to have to prepare for that next phase of my life, but I'll still probably be that creepy dad watching him at soccer matches when they're adults, which is all cool.
That's a interesting way to put it.
Yeah.
But yeah, I think, yeah, imagine your love of watching sports and then a proud father, that the combination, that's what I'm looking forward to.
Yeah.
My kids are 4 and 5.5 and they're just getting into it at the moment.
That age.
But to watch that development
Yeah.
and to participate with them. I don't know if did you ever play sports with them?
I did. A number of sports injuries have kept me out, but yeah, but it's, I'm like,
I might hold off on that dream then. I want to keep walking around.
yeah.
But Fonda, thank you so much for being on the podcast. Really appreciate having you on. It's been a pleasure speaking
Thank
with you.
you, Anthony. Thank you as well.
Cheers.
Are we going to do the high five?
High five.
Why not? Thank you.
Thanks, guys.